cold laser therapy. Also has tremendous applications, and the reason being, PEMF is low frequency, and cold laser therapy is high frequency. So for cuts, wounds, burns, sinus congestion, headaches, sprains and strains, the laser is a tremendous tool, and it is a bit more portable.
Actually, can we try that on my foot?
Sure.
Do I need it to be bare, or can it just go through the skin or through the sock?
Where's the problem?
It's right there.
So laser therapy, being predominantly an ATP generator in that area. Also increase in blood flow, lymphatic drainage. All very positive.
So it differs from a normal laser how then?
Well, normal light is very diffuse.
Yeah.
If you could see the laser beams that are in here, or the laser diode, every single photon that's coming out is going the exact same power, same amplitude, same waveform, and same frequency. That's not the case with the diffuse light.
Okay. Some lasers have the heat.
Right. This one does not. This one's 5 milliwatts.
Is it? And that's what makes it cold lasers. That it's a low wattage.
Right.
Okay.
But even some of the newer lasers, up to 15 watts, can still be considered cold because they pulse them so quickly that there is no tissue heating.
Oh, interesting.
And the one that we're using on your foot is about $4,000 and is not the top of the food chain anymore.
Oh, wow. And what's that one called?
This one's called the Q1000. It's a tremendous device, but I would recommend for that kind of money, if one wanted to get into a clinical device, Dr. Steve Schwartz's asabalance.com. It's called the LZR7.
Okay.
It's a wonderful little handheld with about 250 modes.
Oh, wow.
And it's 500 milliwatts. Actually, our chief technical officer here at Pulsed Harmonics has been battling with a skin issue, and using the PEMF and the LZR7 from Dr. Schwartz and the nanoxide, he's almost 100%.
Wow. That's
No surgery, no pharmaceuticals.
That's fantastic.
It's a great testimonial.
So it regenerates skin too then?
Mm-hmm.
Well.
Now, just my personal experience, the combination of PEMF and laser is really powerful, or any type of light therapy. If I had to pick one, I would go with the PEMF, just because it's so foundational.
Yeah.
It's a lot easier to recreate light situations by getting outside, what have you, but it's almost impossible to recreate that PEMF field because of our artificial environment.
And those little small devices like the zappers and whatnot you see are not as effective. You'd have
Well, they're great, but you do get what you pay for typically. Unlike with Pulsed Harmonics, which is a great deal because you're basically getting a $20,000 device for $3,300.
Right, that's a significant price drop.
You're also covering a lot of bases where you can it actually supplants many of the lesser priced mats. Excuse me. Because there's probably a dozen manufacturers who make low-powered PEMF mats, which do have value, but they don't have much flexibility because they're only low power.
Right.
They're not going to regenerate knee tissue, knee cartilage. They don't have that robustness to get deeper into the body with any type of power.
Yeah, I would think especially with joint issues, then that would be important.